physician from St. Louis, Missouri, and I have the really wonderful privilege of being a full-time EMS physician or EMS medical director in St. Louis. I am board certified in both emergency medicine and EMS medicine. I do hold a adjunct professor appointment at the Washington University School of Medicine in St. Louis. I was actually spent most of my professional career there, starting at Barnes-Jewish Hospital in 1997. And for a whole 13 months now, I've been the chief medical officer at the St. Charles County Ambulance District in St. Louis, Missouri, and the privilege of serving as past president of the National Association of EMS Physicians as well. So I'm really excited for this opportunity to speak with you today. I want to thank everyone for the kind invitation to share my experience. And I have the fun and very easy task, frankly, of sharing why I think EMS is such an exciting way to start a career in healthcare, or to even just have a career in healthcare in EMS. And just so that you kind of have a little bit of a background about where I'm coming from, a brief overview of my service and demographics. So the St. Charles County Ambulance District is located in the greater St. Louis area. We are the first county immediately west of St. Louis County in Missouri. Formed in 1974, the St. Charles County Ambulance District has grown quite rapidly over the decades to become the largest single ambulance district in the state. We cover just under 600 square miles with a population of about 405,000 people. And we're busy. When I first started here part-time with the district in 2006, I believe we were just under 30,000 calls for service. Last year, we surpassed 54,000 calls for service. We are projected to surpass 75,000 calls for service by 2029. Our ambulances put over 1 million miles a year in running calls. We have quite a number of cardiac arrest saves, which is probably the national benchmark about how an EMS service is doing. Even though cardiac arrest, when your heart stops, accounts for maybe 1% of all of the calls that an EMS service does, we really, most EMS agencies focus their time and energy in quality assurance and continuous quality improvement on that particular call, because nothing else truly tests the limits and the function of an emergency medical service than a cardiac arrest call. And so we're very proud. We have a national, the national cardiac arrest survival rate is about 10%. Ours is just shy of 17% as of a week ago. So we are incredibly fortunate to have a robust training division, which I'm going to talk about in a moment, and really, really dedicated employees. So we have about 19 stations, soon to be 20 at the end of 2028, and one unified headquarters that combined about 7 buildings into one. That's about 3 years old. It's really great. And that map that you see on your screen is just kind of an example of where our stations are located in St. Charles County. You know, when someone calls 911 in an emergency, it begins a whole cascade of emergency response, from the emergency medical dispatcher to the first responders. That includes police, fire, and EMS. And there are various levels of training in this paradigm. Sometimes there are also pre-hospital registered nurses. We are seeing an increase in pre-hospital mid-level providers in the form of physician assistants and nurse practitioners. And of course, more and more EMS physicians are out there in the field like me. Because of the relatively short time that we have together, we're going to focus on talking about these two, which forms the core of our first responders. That's EMTs and paramedics. And a lot of people actually do not know the difference between an EMT and a paramedic, and people use the terms interchangeably, and they're actually not the same thing. Just to give you a quick overview, when you are talking to your students and maybe counseling them on healthcare careers, an EMT is an emergency medical technician. It is 1 semester of training. Its scope of practice is non-invasive and maybe some limited medications, limited pharmaceuticals. They are considered BLS clinicians, or basic life support. Now, whenever I give this talk, and certainly whenever I begin teaching EMT classes, I'm very quick to remind them that BLS, or basic life support, does not mean unimportant, because a lot of people, including the students themselves, will hear, well, I'm just a basic. And I say, don't let the word basic fool you. Basic is fundamental. I wish we could just call it fundamental life support instead of basic life support, because that's really what it is. Even my work as an emergency physician, when a patient comes through those doors of the emergency department and they are crashing, they're not looking good, the first thing we do is not give them medications. We give them basic life support. We make sure their airway is open. We make sure they're breathing, and if they're not, we breathe for them. We make sure their circulation is good, their blood's going round and round, and if it's not, we do everything we can to support that. But even those major illnesses or traumas start with solid basic skills. In fact, in EMS, the EMT is often given the most important job, which is chest compressions, doing CPR. So the ABCs, the basics, are fundamental. After they finish this semester of training, a lot of EMTs can choose to stay at this level and work on an ambulance. But thankfully, a lot of them decide to go on to become a paramedic. Being an EMT is a prerequisite to paramedic school. So in other words, you don't just go to paramedic school, you have to get your EMT license first, and then you can be a paramedic. A paramedic is an additional year, 12 to 14 months of training, again, after EMT. So total to be a paramedic is closer to a year and a half. There are some programs where for a few more classes, you could get your associate degree. Often it's an AAS, an associate in applied science. Paramedics are considered ALS clinicians, or advanced life support. So paramedics, therefore, are able to do invasive procedures, including some surgical procedures like a surgical airway. If they're choking, for example, they can't get a breathing tube down in the mouth, then they have to cut a hole in the throat and put a breathing tube that way. Advanced pharmacology, starting IVs. The most important thing I tell my paramedics is that, well, yeah, just because you're advanced doesn't mean you forget your basics. So even an ALS assessment begins with basic life support. So I tell them that the most important skill, of course, is not doing more, it's knowing more. So that's the first thing I talk about in paramedic school, is don't get caught up in, oh, now I can do more things. It really is knowing more things, a higher level of knowledge. At the St. Charles County Ambulance District, we have an EMS training academy, and we offer both, actually, EMT and paramedic. Not every school offers both, but we do have an EMT school and a paramedic school. And our EMT graduates very often form the majority, the bulk of the pipeline into our paramedic school. So as you can see on the screen, good-looking class. We have a great need in the next 5 to 7 years in the first responder community, not only here locally, but frankly, across the country. When you think about the history of ambulance service and EMTs and paramedics, it really took off in the early to mid 70s, 1980s range. And so many of these first big cohorts of first responders are at retirement age. And we are seeing a great need for EMTs and paramedics across the country. We're afraid, actually, that our pipeline isn't full enough to completely fill all the openings that will be coming available in the next 5 to 10 years. So I was really excited to come and give this talk, because if you're advising a lot of bright students who are looking for healthcare careers, emergency medical service is a really great way to enter the healthcare field. So when they come to school, they will learn what the star of life actually means. And I'm sure that you recognize the star of life. You've probably seen it on your own local fire and ambulance vehicles. Did you know that the star of life actually stands for something? Those 6 points on the star stands for detection of an emergency, the response itself, reporting so that you can send ambulances for on-scene care, and then, of course, the paramedics and the EMTs have to give care in transit when they deliver you to definitive care at the hospital. Once you become an EMT or a paramedic, there are continuing education requirements. I'm sure all of you also have CE requirements to maintain teaching licenses. For an EMT in the state of Missouri, it's 20 hours per year. For a paramedic, it's almost 30 hours per year. For National Registry paramedics, it is 30 hours per year at minimum. Every state is variable. Some states require more. I don't think there are any states that require less, but it is variable across categories as well. Categories like medical, and here are some examples of medical hours. In other words, they can't get all 30 hours in medical. They have to get a certain percentage in medical operations. ARV, which is airway, respiratory ventilation, cardiovascular, like cardiac arrest, stroke, ventricular assist devices, and of course, trauma is its own category, because that's a big killer of many, many people. When it comes to a market analysis, I get the question a lot. Well, it doesn't sound like being an EMT or paramedic necessarily requires a degree, and that is true. It not necessarily. I will tell you, however, that the bigger, more competitive EMS services do require degrees. So for certain ranks above captain, for example, most will require at least a bachelor's degree. And senior leadership, a lot of agencies are preferring, if not requiring, master's degrees and above. Now, I understand that most of the audience today are health science teachers. And as this talk is about education requirements, I'm guessing that health science teachers would be interested in things like program length and accreditation requirements, degree requirements, and things like that. But you know who does not care at all? Who doesn't care at all about any of this stuff? It's the 911 caller. The 911 caller does not care if the person coming to their emergency is a union, non-union, part-time, full-time, black, white, fire department, private EMS, third service. They just don't care. They want clinicians who are going to give competent and compassionate emergency medical care. And this is something that's probably one of the most difficult things to teach sometimes. We can easily teach skills, we can easily teach drug calculations and the science part, but getting the students to really see beyond the fact that these are human beings at the worst time of their life is pretty important to get across during the educational career as well. One of my mentors, Dr. Bill German, he was Missouri's first state EMS medical director and an ER physician himself. He always used his bully pulpit as the first EMS state director to talk about his slanty pedal theory. And he said, you know, Mama German never cared how a car worked. She just knew that the slanty pedal made the car go and the square pedal made the car stop. And he always used this analogy, which is so good, I think, to remind us that the people who call 911 also don't care about how the system works, what degree you have. how much training you've had, et cetera. They just want to know that you're good at what you do and that you can do it competently and compassionately. Because after all, that is the bottom line. In our field of EMS, we answer calls for help and we save lives. And my people do it on the regular. And it's really a privilege for me even to go out there, be in the field with them to run calls. But also knowing that 24/7, 365, I've got 260 paramedics out there answering the call for help and saving lives. I kind of alluded to our cardiac arrest save rate. We have a survival to discharge rate of almost 17%. And I just have to brag about them a little bit because again, this is substantial. When you consider that the average across the country cardiac arrest save rate is 9 to 10%, it is substantial. What helps is that we have a lot of bystander CPR in this county. Not every locale has a lot of bystander CPR, but that's something else that I always encourage people to do is learn CPR. It's super easy. The American Heart Association has classes in every state and every town, it seems, and at least nearby, and it really matters. So, and I remind people, you don't have to be a nurse. You don't have to be an EMT or paramedic. You can just be a regular citizen who wants to help. Learning CPR is super easy, and man, it makes a big, big difference. As you can see at the bottom right corner, in our county, we have almost a 50% bystander CPR rate, and that I am positive that contributes to our nearly 17% survival to discharge, which is just remarkable.
Dr. Tan. Hi, this is Nancy.
Yeah,
Would you attribute that to that high percentage of regular people being trained in CPR?
yeah, we have a very robust outreach program where we visit every high school and we have our volunteers, paramedics who go out there and we can train up to 100 kids in a high school gymnasium at a time how to do basic life support that includes cardiac arrest recognition and CPR. We have mannequins that light up that when you're doing it correctly, you get a green light. And if not, it shows you different lights and the instructor can tell you what to do better to make quality chest compressions more effective. And we do free classes for businesses. Our public relations arm will go to banks, businesses, private businesses, and do free classes and maybe do a class for 12 office people or 20 and over the lunch hour do a quick review of what CPR is, how to do it. It really is a lot of outreach, but it's so worth it. You know, when we see the results, you can't argue with the results.
Yeah. Thank you. I thought that would be of interest to some
Yeah.
of our educators on the call here.
Yeah, there are a lot of states, and I'd be curious to know if they want to put this in the chat as well. Um, if they're in a state that requires CPR training for their high school students, because there are many states that say that as a condition of graduation, um, the student has to have had CPR training. And I can tell you that in our county, um, we have had clinical saves where a family member who happened to be a young person who got our training did CPR on their loved one and helped get them back. So we are undoubtedly reaping the benefits of an aggressive community CPR and education program. So that is never a waste of time to learn CPR.
We do have in the chat that let's see, Texas requires high school seniors to have CPR training before graduation. And Bill, I believe he is an EMS teacher, if I'm remembering correctly. Is that right, Bill? Yeah. requires CPR experience. You want to tell us what that means, Bill? What experience means? Because you have it in quotes there. You can unmute yourself.
Yeah, what's that?
It's it's kind of open interpretation. So our district, we take our EMT students over to the middle school and train all the eighth graders, and it's hands-only CPR with the AED over the course of 2 days.
Mm-hmm.
And so they're not required to have a certification, but they are required to have an experience. And for us, at least the hands-only and the AED and the time that we have to do it is it works out well.
Very good.
Oh, and from North Carolina, they require CPR training to high school students prior to graduation. Lisa, is that certification or they just have to go through a training? You can unmute yourself if you like.
They actually just have to go through a training.
Mhm.
But we're very fortunate at our school because local EMS comes to our health science classes and offer the students the opportunity to do an EMS ride along. And they can do that for up to 3 school days. And it is a absent, it does not count against their absences. So we have probably at least, and we're a small high school, but we probably have at least 20 students a year that take advantage of this opportunity, and it's wonderful.
Oh,
That's
that's
fabulous.
yeah. And then Kathy, what did you want to share what you had there in the chat about Vermont?
Yes, there's been talk about making it statewide. I don't think it is there yet, but many, many high schools, that is their goal, that students at least get the hands-only CPR, and they're doing that via the health classes.
That's very cool.
Okay.
Very cool.
All right. I'll give you back the microphone, David, but I just thought it'd be interesting to hear from these folks. And Lisa,
Yeah.
I love that what happens in your community. I know that it comes back to like building their own within that community, and hopefully some of those students then go on to become EMS professionals.
Yeah. I love that because as I really like the ride along program because a lot of people, especially high school students, they may have kind of an interest. I'm sure everyone sees the ambulance in their community from time to time or the fire truck, and they're wondering, well, what does it take to get into that field? And they just have no idea what a rewarding career EMS can be and what it is. And so those kind of programs are definitely going to, especially with 20 kids a year taking advantage of that. That's amazing. No doubt we will be reaping the benefits of those ride-alongs when they do decide to go to EMT and paramedic school and make a career of it. Because, like I said, we're really kind of concerned about the future outlook in the next 7 years or so, with the retirement horizon being so full. There are already a lot of places that have shortages of EMS professionals, and sadly, especially in rural areas, I just saw a news article where an entire ambulance service had to close because they didn't have anyone to work. And so they were depending on neighboring counties for mutual aid to come into their county if something happened, which when you think about time critical events like a choking or cardiac arrest or a stroke, that can be really bad for the community. So I love hearing about the things that other states and programs are doing to encourage careers in EMS for sure. I know that a lot of the folks on this call will have the opportunity to counsel high school students in career choices, including EMS. And just so that you have kind of a broader idea of what you can tell them, I will tell you that most will serve their entire career working the ambulance, answering calls for help because it is very rewarding. However, EMS itself can often be a springboard to other branches of medicine and even other branches within EMS. A lot of people will tell you that longevity depends on some variety and not just answering calls on an ambulance day in and day out. And there are actually some subspecialties in EMS that you can tell them about, like this one, for example. This is a picture of some of my paramedics who are certified medical specialists in urban search and rescue, or otherwise known as USAR. So these paramedics work primarily on an ambulance. However, they're also on call for special teams. So things like this example in training where a mountaineer is trapped or a hiker is trapped somewhere and they have a broken leg, they need to be extricated. They have special training in rappelling and rope rescue and urban search and rescue as well for collapsed structures like in tornadoes, earthquakes. And they can, beyond what a normal paramedic would know how to do, they would be called upon to perform the rescue, provide medical care in very dangerous environments or austere environments. And it's incredibly rewarding. And what we have found is that paramedics who do these subspecialties, they end up having longer careers, more satisfying careers, because they are doing something they love to do, and it is more than just answering the call for help day in and day out on an ambulance. Other examples of special teams include our honor guard, for example. Our technical response unit is largely our drone unit. Our drone program is really expanding fast. We're learning how to use the drone to find lost people, lost hikers. We're even using drones to deliver medications, looking at how we can deliver an AED in a remote area and get the AED there before the rescuer actually gets there, things like that. We have a very robust and mature tactical EMS unit, or TEMS. They are medics who have special police and rescue training. And so some are sworn officers, but the majority of programs around the country, they are paramedics, but they get special tactical training so they know how to safely work in the dangerous environment of tactical operations or SWAT operations. And then, of course, I just showed you the USAR medical specialists who work in tornadoes, floods, confined spaces, and things like that. Maybe not as glamorous as being a SWAT medic or a USAR medic or technical response unit medic is our preventive medicine bureau / public relations. Some of our medics really connect with people, and they like doing things like car seat installations, Halloween safety, our lifesaver CPR classes, rapid access program where they can have special key boxes installed outside of high-risk houses. For example, the elderly who live by themselves, they can participate in this program where only the ambulance district has a key code and can get their key to their house, so they don't have to break the door down like we have to do so often for people that don't participate in the program. These community connections are incredibly important as well, and also provides a lot of satisfaction for the medics who participate there. We have a really mature CERT program as well. CERT stands for Substance Use Recovery and Response Team. These paramedics have special training in substance use disorder management, evaluation, and treatment. In 2017, we were named the Community Impact Program of the Year by the American Ambulance Association for the number of people we have saved through opiate reduction programs, opiate treatment programs, harm reduction programs. Is also incredibly heartwarming to help people that were given a second chance at life. We also have a really long-standing MIH program, Mobile Integrated Healthcare. These paramedics are specially trained to deal with the management of chronic diseases that become 911 problems because the patient just doesn't know what else to do. Like they don't know how to take their medications right. They have frequent falls at home, things like this. The medics can go in there and make sure that they reduce risks. They do an assessment in the home. They make sure their medications are filled out properly and refilled properly. things like that. Very, very rewarding as well. Sparking a bigger dream in healthcare, I know is a topic that the organizers wanted me to touch on. Again, a very easy task because EMS often serves as a catalyst to launch careers in other healthcare fields, like being an EMS instructor or educator. A lot of paramedics go on to nursing school to become a nurse. One of my deputy chiefs just became a board certified family nurse practitioner. Many go into executive health administration. At the bottom is a picture of Dr. John Rains. John is a former paramedic of mine over a dozen years ago. And I remember him because he always came into my office as a paramedic and asked me lots of great questions. I mean, my paramedics ask me good questions all the time, but this person in particular, John, was always asking very, very deep second and third order questions. And one day I said, John, you need to go to medical school because you're asking some really deep questions, way more than usual. And he said, oh, no, I could never do that. I'm too old to go to medical school and be a doctor. Well, long story short, we had several more conversations. And today he is an emergency medicine physician. He is finishing up his EMS fellowship and will also be board certified in EMS medicine. And he just signed a contract to be an EMS physician in Missouri. And I'm just really, really excited. But that is just one of a few students I've had who went on to medical school. And so it's really heartwarming to see that happen as well. Now, I know that I've been singing the praises of EMS, and if I had to do it all over again, I would definitely do it myself. But I don't want to be misleading. I want to make sure that if you're counseling students on an EMS career, you should at least know that there is, as there is with a lot of first responder job, a little bit of darker side. Not everything is awesome in EMS. Many first responders, unfortunately, have a hard time dealing with some of the very difficult calls that they see on a daily basis. The CDC recently published this call to action to address the disproportionately higher rate of suicide among first responders, to include EMTs and paramedics. Now, we do not at all have enough time to go into the complex causes of suicide, which are multifaceted, very personal, a lot of socio-demographic factors to consider. But suffice to say that first responders can see some pretty horrific things. And it's not always easy to deal with because, after all, what are the types of people that go into EMS? Caring people. And so caring people who are normally empathetic can really start to feel empathy to the point where it's unhealthy. And so it used to be thought that, well, this is part of the job. Depression's part of the job. Stress is part of the job. And they were afraid to say anything after a bad call because of the perceived stigma and the fear of being labeled unfit for duty. And so when you think about how we study this problem, it makes it difficult because occupational data may be incomplete or difficult to capture because it's underreported or because a lot of first responders have multiple jobs and maybe work in a volunteer capacity. So we actually feel that a lot of the mental health problems are underreported in the industry. I will say, I'm proud to say that the industry as a whole is getting much, much better at addressing these issues. The stigma of peer support and critical incident stress management is not nearly what it was when I started 20 years ago. In fact, I'm happy to say that now it is much, much more accepted and expected that after particularly difficult calls, they be taken out of service, to get a debriefing, to do a hot wash, and to immediately begin the management process so that after many years in EMS, they don't end up having more harm than good from the career. Suffice to say, I believe the good outweighs the bad. Otherwise, I wouldn't be talking to you today. The majority of my folks come back to work day in and day out because the good outweighs the bad. And because a career in EMS is just, like I said, so rewarding, especially when you get to meet the people whose lives you saved. Every year we have a survivors banquet where we invite the paramedic crew and the survivor and their families to come enjoy a nice lunch, and they get to present them with the award. Very few dry eyes in the house that day. And it's just incredibly satisfying when you get to see those loved ones enjoying more time with their family because of our efforts. And it's really, really cool. If I had to summarize our talk today, I would say that beyond the traditional 911 response, EMTs and medics really have transformed care around the world. I always like to remind them that EMS does not bring patients to healthcare. EMS is healthcare. And that was not the case when EMS just started, I can tell you that. But it has evolved to be an essential link in the healthcare chain. EMTs and paramedics save lives every day in their communities. And when people experience the worst days of their lives, EMS is there for them. And an EMS career actually enables students to live the exciting world of healthcare at its most urgent. It does give them a rewarding and fulfilling career in public service. And many EMS professionals, as I've shown, may also be sparked to enter numerous other healthcare professions in hospitals, clinics, educational institutions, and much, much more. So my email address is there on the screen. I'm happy to, of course, entertain any questions you might have now. I do believe we have some time to entertain questions. And feel free to also email me if you have any other questions that I didn't answer here or that you might forgot to have asked during this call. So, and again, thanks for the invitation to share this exciting career pathway with you today.
Thank you, David. That was great. Sad ending, but it was good to make that clear. Questions for anybody has to ask of David?
I do. Bill Nice from Minnesota. With where is it? Ride along with ride along obstacles. So I'm getting some services that are starting to open up that before with, because I teach high school kids. Any suggestions? Because the people on the ground want to have our students ride along, but people that wear blue suits and red ties, I think, to work don't. Is there any suggestions to how do we get around that, under it, over it?
Yeah, unfortunately, that is a problem. The way that we have structured it is, and some of the barrier does have to do with HIPAA concerns and having, who requires a business associate agreement and all those kind of things. We put them through a mini class that talks about privacy and privacy expectations, dress codes, safety waivers, all that kind of thing, non-disclosure agreements and things like that. We do limit it mostly to students or prospective students. It would be hard to open it up generally because I think we just have so many. And part of our problem is we also have such a large enrollment in our EMT and paramedic schools that we just don't have a lot of room for ride-alongs, because almost every shift and every ambulance has a ride-along already on it in the form of a student who has to be there. And so, but it sounds to me like the issue you're having is simply a unwillingness.
That's it. Yeah.
And so
can't get past the legal team. So
yeah. Has the legal team actually spelled out like what their hang up is, or is it just they're hiding?
they won't budge on, they have to be 18 and they have to have a high school diploma. Even
Mhm.
though these are students that are, some of them are already certified as EMTs. If they come back their senior year, if they took it as a junior. So, like I said, the supervisors, the medics in the trucks would be happy to take them, but so it's, I don't, we're starting to get some other opportunities. Unfortunately, one of them's, the next state over. So it's kind of a hike, but
Yeah.
we're some doors, but I was just curious if you had any suggestions.
It sounds like you've tried all the things that I would suggest, like a face-to-face discussion and kind of trying to
Yep.
break down the barriers and find out what it is. Perhaps another angle would be if they instituted an Explorer post or Explorer program.
We're
Or-
already a post,
Mhm.
but okay, yeah. So we're already a post, but if the service wanted to do that too, because I know the ones that we do have the opportunity to ride with, they request and require that our students are explorers already, just
Okay.
because it provides health insurance, supplemental health insurance, and then the liability insurance as well. So it protects them and protects our students.
Yeah, that helps a lot. I wish I had an easy answer for you, but this is a problem that a lot of locales are dealing with, and a lot of it is just, honestly, a lot of it is just political.
Mhm.
It's who is sitting in the risk management seat. You may have the exact same agency with a different attorney, and all of a sudden they're all for it. So
Right.
there's not, how do you work around that? I don't know. So
I was thinking that we need just a change in the leadership, right?
yeah,
Might be the best.
that
Um,
is that is often the solution.
Lisa, do you have any kind of agreement? Or I know you're in a small community and everybody knows everybody kind of thing, but I didn't know if you had like a formal agreement with your
We
EMS.
do. Matter of fact, they actually went to our school board meeting and they drew up a contract of how, they want the ride-alongs to go. The student is required, and of course their parents is required to do a form, and that form has to be notarized and stuff. But it was a formal process for this to happen in our county, and it got started about 4 years ago. But and when everybody came to the table at the board meeting, I mean, it was a good thing. It was a positive thing, so they made sure it happened.
Well, are those kind of written agreements, or is there a process? I didn't know if that was something you could share with Bill, realizing that Bill probably still needs leadership change, but I
Right.
didn't know. Bill's email is in the chat there, and
Okay.
and
And I personally don't have those, but my CTE director probably does have that information. I could probably get hold of it and send it to Bill.
oh, that
You
would be
know,
great.
yeah.
All right, and I see Rossi from Delaware. She's the health science tech leader there. Rossi, is that a new hand? Did you want to speak?
Oh, yes. Hello. I just have two questions, and thank you so much. I was really looking forward to this to the meeting because, like I put in the chat, we're actually trying to adopt the state model for EMS, and I'm actually right now in the process of building a committee or a roundtable, if you like, to kind of start with the first step and making sure we have like all the key players involved and all that good stuff. So my first question is, since we're moving to the state model, one of the things that came up is the labor gap analysis for EMS or for EMT in particular. Is there a way that you have found to help increase student participation within the pathway? Keeping that like I guess in the forefront.
How to attract more students? Is that what you're asking?
Yes, yeah, because our students, I won't say for all, but a major concern is that it's not a sustainable pathway as far as like for a career, but definitely needed because a lot of our students that have who are in the pathway now at the local levels really appreciate because it kind of gives them like a heads up into the medical profession, prepping for like nurse practitioner, doctor, things of that nature. So they're really or really take it to it. But as far as like the engagement piece, the struggle that I have received is like, well, they're looking at the bottom line, which is, that career labor metric piece. And so I'm just curious to see, what have you found to be successful as far as like increasing participation engagement, so that way they can still participate in the pathway, gain those industry recognized credentials, and to prepare them for that next step, in further medical professions and degrees.
Well, I'll tell you the easy answer. And St. Charles County, my agency has not had the same difficulty as our neighboring counties in recruiting because of exactly what you said, the bottom line. So we made a strategic decision some years back, knowing that if we have a revolving door of employees, and every 24 to 36 months we're having to hire new employees because they keep quitting to go to higher paying jobs. Because when you look at an EMT pay, for example, you can make more money as a manager at Wendy's or McDonald's than
Right,
EMT.
right.
And that's pitiful, right? When you look at the responsibility charged to an EMT and a paramedic, that you can hardly sustain a livable wage as a EMS worker. The interest is there, but the practical nature of choosing this career in many states is impossible, makes it impossible. It is so variable, and this is a really good question of yours. It is so variable. I haven't even gotten into the different deployment models of EMS. So for example, there's private EMS, which traditionally pays much less per hour. There's fire-based EMS, and even that depends if you're a fire department or a fire district. A fire district very often can pay much more than a fire department because a fire district has its own taxation authority.
Oh, wow. Okay.
And they don't necessarily have to share, whereas a fire department has to share the same pot of money with public works and lighting and water and trash pickup and every other municipal service. They're fighting over the same dollars. We have third service. Now, my agency is a third service. So we are an ambulance district. So we do have our own taxation authority. We have worked very hard over the last almost 2 decades at increasing wages to the point where it's actually very attractive to be here. St. Charles County Ambulance District is considered a destination agency, meaning people try to work here for the long haul for 30 years and their entire career here. Our average tenure is 17 years. And that's it's that low only because we've just had a whole bunch retire, and we've hired 60 new paramedics in the last, I think it was the last 3 years. So that has brought our average tenure down from the 20+ year range to about 17, which is still triple the tenure of a lot of our neighboring agencies.
Right.
But I can tell you, because it's public knowledge, our starting paramedic makes $85,000 a year. And that's the start. And that does not include overtime. And that does not include when they become promoted to officer ranks. And that's working 10 days a month. Now they work 48 hours at a time. So it's brutal. But after a 48-hour shift, they have 4 days off. So it's 2 on, 4 off, 2 on, 4 off, 2 on, 4. So it ends up being about 10 shifts per month. It's brutal work, but as I showed you, it's also incredibly rewarding work. But we pay our medics very well. We also expect a lot out of them. They train and train and train. And like I said, we have a 17% cardiac arrest survival rate, which is remarkable. And but that's just a small reflection of all the other calls that they do equally well. So we pay them well, we train them well, we treat them well, And as a result, our patient care is better, and we have very little turnover, except for those who are retiring, of course. But I came from a private service, for example, where it seems like we hire them and 18 months, maybe 24 months later, they go on to another agency that pays a lot more because it was a private service. But we spent a lot of money on training and orientation just because it was a revolving door of people. But that's the nature of private EMS. It's just different. So the very long answer to your very good question is it really depends on the model of operation, whether it's a third service, public utility model, fire-based, fire district-based, private. So many factors are coming into play that it is hard. And it also, what makes it even more difficult is that EMS is not considered an essential service in most states. I know, let that sink in, right? Police,
Yes, yeah, I was
police is an
just,
essential service. Fire is an essential service. EMS is not an essential service in the majority of states, meaning there is no obligation for a government to supply ambulance services. They do have to have police, they do have to have fire. And now people equate fire with EMS, which of course is also not the case. There are
right,
lots of fire departments who don't do anything but fight fire, which is fine. But to assume that fire is EMS is incorrect. So that may be the case in a lot of places because fire is the only thing that's around because they're an essential service. And so by default, they become the EMS provider. But even there, they may not be able to sustain an ambulance. So they are fire first response, and they stabilize the patient until an ambulance from 50 miles away can come in and transport the patient. So that's one of the things that my work at the National Association of EMS Physicians has been trying to do in partnership with our stakeholder organizations to make EMS an essential service, to be more consistent as far as funding for EMS. And of course, like any industry, like any business, the bulk of your expenses is wages and benefits. But it's your people. And especially when it comes
right.
to EMS, the most important asset is your people. So yeah, it's a conundrum. And if you can figure out how to make that bottom line higher across the board, let me know. Because we're still trying to help figure that out too.
No,
But
thank you so much, because I'll actually definitely be following up with you on that, because there were some key things that you stated that was just like, oh, okay, I have to make sure I have this in the forefront when I bring the required people to the table when we set the state model out. So thank you so much.
yeah.
Okay, we have about 5 minutes, and Rossi, did you have one more question? And then I have one more question here in the chat.
No, ma'am, I'm good. Thank you so much. Thank you.
Okay, I'll read Jane's question because she might be shy. She put it in the chat. Jane Stone said, have you invited or had students attend the survivor event that may help with interest and recruitment in EMS?
Yeah, I know that we have had some students who were involved in the SAVE was there. Since our events are typically held like at various venues, it gets kind of expensive if all 120 students attended. So we have not admittedly made a general invitation to them, but at some events we've had the students who come and they can work as servers at the event to help out, or if they actually were on the team that helped save them, which also happens, they're of course invited as part of the team to see it. But it gets, I tell you, everyone sees it, at least news clips, because it's a very popular media event. And we always have television crews there at the event because it's such a feel-good story. And who doesn't like to see survivor events? It's really heartwarming. So.
Well, Bill put in, he's got some competition for you salary-wise here, I think. And he said in Minnesota that since COVID, that the fire paramedics starting at 100K for fire departments, and the privates are paying paramedics almost $50 an hour.
Yeah,
after-
I have heard about agencies, especially post-COVID, because we lost a significant number of clinicians during COVID. not only to the disease itself and long-term effects, but because they saw how EMS was treated, which was atrocious.
Yeah.
You know, police and fire were given first dibs on vaccinations if anyone wanted that, but EMS was considered second tier. And we're like, what? Who do you think is going into the house and what are you talking about? It's that kind of thing that just baffled me and just drove me crazy. But you know, who should be first in line for PPE? It was hospitals, and EMS was second. And I'm like, who do you think is bringing them to the hospitals? And so, yeah, baffling. But people saw how EMS were treated, and we lost a lot. And what we found is that the only way to truly recruit and retain was increasing the pay from sub-minimum wage almost to a livable wage. And so that is better. I'm glad to see in Bill's neck of the woods things getting better. I wish I could say that that was the case for all locales. It just isn't. But in some areas like Minnesota, that's awesome. But yes, we have learned that that is really the only way to recruit and sustain, is giving a very competitive wage. You should not be able to work at Walmart or Target and make more money than being out there saving lives every day. And I think that resonates with most people. Just making it a reality for politicians and such is still an uphill battle sometimes. But we're trying. We're making some headway, I think, for sure.
David, you have been very generous with your time. You also did not mention that you do some work with Jones and Bartlett, one of our publisher NCHSA members. And what book is that you consult on?
I'm the medical editor for Sanders' Paramedic textbook.
Okay. All right. Well, the invitation still stands for you to tell Jones and Bartlett that NCHSE said that you need to be a presenter in Cincinnati the last week in October. So I'm going to send you that information so you can say,
Thanks.
I've been
You
invited by this prestigious group to be at their conference. Okay.
you put a good word in for me with Tiffany, and we'll see what we can do.
I will do it. I love your presentation. We'll put the presentation and the recording as soon as I stop the recording.